So the next question we get a lot is, how often should I wear my shrinker?
Shrinker is a compression sock or garment made to just help extract or reduce the post-operative fluid from the residual limb. You will have quite a bit of fluid.
A lot of times you'll hear the term edema.
Yep, swelling, edema. So what you'll notice is if you got a lot of swelling and you touch that residual limb, it'll be very hard. As it starts to go down.
Maybe the skin can get a little cracked, flaky, things like that.
And it also can, that's a lot of pressure on the suture line. So reducing those fluids can help with the, with the healing the suture line. Increased sensation is increased sensitivity, like you said, so which means more pain.
Right. A lot of times having all that edema can kind of signal nerves that there's a problem. So getting some compression on the residual limb as soon as possible can even help to help let those nerves know that things are okay, that the body is healing, that there's not as much of a problem as what they're sensing.
I'll tell patients a lot of times those nerves are severed during the amputation, and they're looking to be embedded back into that muscle tissue. So that's why compression on the outside of that residual limb feels good.
Here's a few examples of a shrinker, and there are lots of different styles of shrinkers. Some that you'd roll halfway onto your leg, and then you'd reflect the second part back up. So this doubles the compression. And you can also kind of choose where they stop, whether one goes a little higher than the other, ends a little bit lower, or they both end at the same point. This one is more like just a traditional nylon or sock that you'd roll on or slide onto your limb, depending on if your suture line is well healed, then this could just be pulled right on. If it's not well healed, there are some techniques. Sometimes even two sets of hands.
I was going to say the two sets, especially if you're in the hospital or the surgery's new, you can cue the individual by having them use their hands with you. So you've got 4.
So now I would be able to slide my limb. Now I'd be able to slide my limb inside this without putting all that tension or ripping force across that incision.
By actually just laying the bottom part of the shrinker over the suture line without having to stretch. Like if you come in like this, you're going to create a lot of traction.
All the way across, and it can really put a lot of painful pressure at the bottom. The thing that's nice about this style is that these are set to give more compression at the bottom and less as it goes up. So it's actually providing a squeeze. You really want the shrinker to kind of end somewhere, if you're below the knee, somewhere mid-thigh, because that will allow, that brings the fluid back to a level where your heart's able to start circulating it. If you're above the knee, then you want the shrinker to come all the way up to and end in your groin, because you don't want an area of what will be the limb that's using a prosthesis to retain any fluid.
Shrinkers can be nice when patients are returning home from the hospital because they're easier to manage than ACE wrap.
And shrinkers do give more consistent compression than ACE wrap, for sure. The thing about a shrinker is it's a good idea to wear it kind of as much as possible. I like to use the term 23.5 hours, but somewhere around 20 hours is good. You want to take it off to bathe, you want to take it off to wash your limb, those things. But other than that, the more you can wear it, the more that compression is going to help your limb get consistent and stay consistent.
At the early stages of the game, the moment you take that shrinker off, fluid's starting to pool up there again.
Well, and it's not even just the early stages of the game, right? I mean, even somebody that's used a prosthesis, so a lot of people ask, how long should I wear my shrinker after my surgery? I mean, should I wear it for my whole life? Some people decide that as soon as their prosthesis comes off, their shrinker goes back on. Some people get to a point where their body stays consistent enough that they don't need the shrinker anymore. Being somebody that has had braces as a kid, I always kind of liken it to the retainer. The orthodontist tells you that you should wear your retainer forever. And no one really does that, but the longer you use it, the more consistent things are going to be. And especially as you're trying to learn to manage your prosthesis and sock ply and keeping the fit of your prosthesis consistent, using the shrinker at night is a good tool to make sure your leg doesn't swell up so much at night when you're not using your prosthesis, and then so that there's less change throughout the day when you're wearing your leg.